discuss the anatomy of ribs. These are 12 pair of ribs in our body that form the greater part of the thoracic cage. The size of the rib increases from 1st till the 7th. The 7th is the maximum in size and then the size decreases afterwards. The 12th is the smallest. Then we classify the ribs into two parts, the true ribs and the false ribs. The true ribs are 1st, 2nd, 3rd, 4th, 5th, 6th and 7th that are directly attached to the costal cartilage and to the sternum. These 7 ribs are called as the true ribs. The remaining 5 ribs are the false rib. The 8, 9 and 10 rib attach with each other to form the costal cartilage, costal margin of the sternum. The 11th and the 12th ribs are called as the floating ribs because their anterior wall floats into the anterior abdominal cavity. The broad classification we have done. Now the another classification is that we divide the ribs into true and false and the typical and atypical ribs. The typical ribs are from 3 to 9, while the atypical ribs are 1st, 2nd, 10, 11 and 12. The typical ribs have similar features, while the atypical rib has somewhat distinct features. Now we discuss the anatomy of typical ribs.